All right. Well, we are on number 5, Cindy. Can you
Yep.
believe it? We've been through number 5.
All right.
Yeah.
Awesome.
Yeah. So Cindy and I are Adaptive Equipment and Caregiving Corner. We have a YouTube channel. We're on all kinds of social media.
Yep.
So wherever you like to see social media, Facebook, Instagram, LinkedIn,
TikTok.
We're on TikTok.
We are on
ladies
TikTok.
on TikTok. YouTube. That's where we started, was on
Mhm.
YouTube. If you find our content helpful, if you find it interesting, we would love if you would help us out by going to our YouTube channel and clicking subscribe. Be a part of the Corner crew. Click the bell. That way you'll get notified every time we release a video. If it's something that you don't think that you would need for yourself, maybe there's somebody in your life that might use it.
Right.
We would love for you to show your appreciation for what we do by just clicking the subscribe button on YouTube. It's free.
Yep.
Cindy is a physical therapist. I'm a speech therapist. Together we have over 50 years of experience for therapy, for rehabilitation, and we just want to share it with people, and that's kind of how we got here. So today we're talking about the 5 tips that we think are important to get prepared for knee replacement surgery. We are on tip number 5, which is educate yourself about physical therapy.
Right.
Occupational therapy too, but
Yes.
more importantly, I think, at this point, physical therapy. What does that mean, Sin?
Well, you're going to have physical therapy. You may have some occupational therapy. Just depends on
For activities of daily living.
Right. How you're doing once you come home. You may be seen by an occupational therapist a couple of times. They may recommend some things, for getting back to when the doctor releases you to get into the shower, getting back in the shower. Maybe, a shower chair to sit down, maybe a tub transfer bench if you have a tub shower combination. Physical therapy, you're going to have, and I can't express enough how important it is to do your therapy. All the tissues that are cut through in the surgery to replace that knee are going to start healing. They're going to start laying down new tissue. And when that does, it kind of lays down haphazardly. And in your stretching and in your work on your range of motion, you are telling those tissues how long they're going to be and in what direction they're going to lay. And it is so very vitally important to work on that motion with your therapist, and do those home exercise programs, because I tell my clients all the time, you didn't go through this surgery for nothing.
Yeah.
You want to come out with the best knee that you can, and you will. But you just gotta really watch swelling, and you gotta elevate, and you gotta ice, and especially those first 2 weeks, it's kind of going to be boring. You got just the exercises. You've got to get up and move around a little bit. You got to get down and elevate it and ice it. It's going to be kind of that grind those first 2 weeks. And then the other thing, Christina, that I tell people as far as the therapy, and I like to remind people of this, especially with knee replacement surgeries, this is a major surgery.
Yeah.
And if you had a major surgery of any other sort, you would be expected that your minimal recovery is probably going to be about 6 weeks.
Yeah.
But because you can start walking on your leg after a total knee, people tend to think, well, I should be doing better than I am.
Yeah.
And so
it's eye-opening, I think.
It is very eye-opening, yeah. So it's kind of a fine balance of making sure you're doing the exercises and you're moving, but making sure you're not doing too much. But I tell people, it's not going to be until that week about 5 or 6 that you start thinking, oh, okay, now I'm happy I did this, and that you're really kind of getting over the hump. And the whole time, and this is just from my experience with clients over the years, is that you kind of have this back and forth thing going on. You progress a little bit, you come back just a little bit, you progress a little bit more, you come back, but you are going to get better. It's just you got to stay with it and keep moving forward and keep doing what your therapist tells you to do.
Yeah.
So
5 or 6 weeks. I think that might be eye-opening.
Yeah.
To a lot of people.
Absolutely.
Because you think maybe a couple of weeks and I'm going to be back doing what, not back doing what you're doing, but certainly I'm going to be closer to being back to doing what I was doing. And I think that's kind of, for me, that's right. I mean, that's a month and a half.
Yeah. And the interesting thing too, with a total knee especially, is there's a lot of strength loss
Mm-hmm.
in the quad muscles, and it just, even after 6 weeks, when you're back to kind of functioning more normally,
Yeah.
it takes a long time to regain that strength,
Yeah.
and you have to continue to work and be diligent about doing that.
Yeah.
But it can be a very successful surgery, and I've seen people, and we've both seen people
Yeah.
that have just been so happy
Oh yeah.
because they were so limited before.
Yeah.
But now they've got the new joint, and
Yeah.
they're getting back to functioning, and they're enjoying some of the stuff and the life as they wanted it to be before, but they
Right.
were limited because of the pain.
Yeah.
So
That's hopeful, Sin. I appreciate you
Mhm.
telling us about that and sharing your experience with us.